This is Stefan Schmidt for InsiderIowa.com. This week, one of the interesting news stories is that a large number of states are now suing the Obama administration over the national health care reform that was passed. And it's interesting because it has a couple of angles to it. One of them is the political angle, and that is that there is a lot of pushback against Obama and the administration over the size of the federal budget, over the increasing influence of the federal government in general. And so there is a kind of political climate that says that government is getting too big. But more specifically, and something that I'm going to be looking for, is that the challenges are coming based on constitutional grounds. And the argument is that the Constitution does not give the federal government and the executive branch the authority to require individual Americans to buy insurance or to buy any product and exercise a penalty and impose a penalty on people who don't comply with the federal government. So it's going to be, once it gets into the courts and begins to make its way through, I think this will be a Supreme Court case. I think this will eventually be appealed to the Supreme Court on the grounds that it really asks a major fundamental constitutional question, which is, what are the limits of the power of the federal government when it comes to something like this? Is this a matter, for example, that gives the federal government certain powers under the Commerce Clause of the Constitution? Or is this something that violates the Constitution's designation and enumeration of powers that are states' powers versus powers that are federal powers? So in some respects, at least, we could say that this is a kind of states' rights issue. And when it's finally settled, and it'll take probably a few years perhaps before it is, we will have some new law, some new case law, some new constitutional law that will establish where the federal government's limits are. On the other hand, the Obama administration and many Americans are saying that health care is such a huge issue in the United States that we have to change the system. I heard a report recently, a couple of days ago, that said that if we continue going the direction that we are, health care will take up 50% of the gross domestic product of the United States. And the experts that were talking about it said that is unsustainable and impossible, and we just can't go there. So this is a matter of how much health care should people have, who should pay for it, should the federal government mandate it? But on the other end, it's also a question of how do we contain expenses? And it seems to me that the two are contradictory. If you force every American to buy health care insurance, it's going to actually generate a lot more money that is spent on health care, and it probably won't do much for the costs. So that's a side issue, I think, that we can talk about some other day. But the constitutional question, can the federal government force you to buy health insurance or fine you if you don't, hits right at the heart of the question of freedom in the United States, individual responsibility versus the role of government. Stefan Schmidt for InsiderIowa.com.